most careers involve 2 or 3 major pivots, and that you need to be prepared for an opportunity that comes at you at the absolute worst time.
Welcome to Doctors Without Borders, the official podcast of the MSU College of Veterinary Medicine. I'm your host, Kristen Lehrer, and today we're diving into the world of veterinary specialization and education with Dr. Steve Carey, a specialist clinician in internal medicine here at our Veterinary Medical Center, and Vasia Murphy, a DVM student who's about to graduate and embark on a rotating internship as she works toward becoming a double-boarded veterinary specialist. Let's get started. Doctors Carey and Vasia, welcome to the show.
Thank you so much for having me. I really appreciate the opportunity to talk about what brought me here and talk about the interactions that I get to have with students on a regular basis.
Yeah, thank you for having me. I'm so excited to be here. I've been wanting this moment for a very long time.
Wonderful. The theme of this podcast really is to explore all of the vast careers within the veterinary profession that are not necessarily what most general public might think of when they think of a veterinarian. But we all start in the same place, right? So please tell us what led you to veterinary medicine as a career.
I'll talk a little bit about my path because I think it was atypical at the time that I went to veterinary school, but I'm finding now that people that find veterinary medicine late in life or as a second career is becoming more and more common. My initial path was human medicine. I thought for sure I wanted to be a human orthopedic surgeon. My family my parents are both attorneys. I've got a cousin who's a transplant surgeon. My uncle owned a huge dentistry practice. And so there were certain careers that were encouraged by my family, both my near family and my distant family. And so some things were never really discussed. We had pets, we went to the vet, but never thought about becoming a veterinarian. So I initially went to undergrad thinking I wanted to be a human physician. I went to Duke University, had an experience at Duke Hospital as a summer intern and realized I really didn't like the structure of human medicine. I thought the doctors would have a lot of hands-on stuff, but it was the nurses who had all the patient interactions and the doctors were in and out of the room very quickly. But I was fortunate that I had a wonderful undergraduate advisor who talked to me about what I liked about medicine, why I thought I wanted to do that. And it was a discussion with her my sophomore year where I considered vet med for the first time. And it was really just kind of took off from there. So never even thought about it until my sophomore year in college. And then got a job out of undergrad as a toxicologist, did that for 5 years while I thought about what I wanted to do, but really that stuck with me, and I applied for vet school after being out and work for about 5 years. So.
Great. Vasia, how about you?
Wow, I never knew that, Dr. Carey. That's great. I feel like I had a pretty traditional path. I always knew growing up that I wanted to be a veterinarian. My parents have like home recordings of me at like 2 years old with a fake stethoscope and my stuffed animal saying that I was going to be a vet. Really what like brought me to it was my cousin actually was a veterinary technician, a licensed veterinary technician. I shadowed her one day at the hospital and I just fell in love with how veterinary medicine ran. She actually worked at a specialty hospital, which is a little bit of foreshadowing as to where I'm going next. I love everything about veterinary medicine. I always had just like a natural draw to animals. There was something about like a connection with them that, you know, I'm an extrovert. I can strike up conversation with anyone. I love talking, but you know, there's just something about the calmness of an animal coming near you, and then them kind of like entrusting you too, that really drew me to veterinary medicine and like kind of caring for them. We ended up getting like our first dog when I was 10 years old. He actually recently just passed away. So he lived a long 17 years, which was great. But after his many trips to the vet, both for general medicine care as well as chocolate ingestions, pancreatitis flare-ups, you name it, I really loved seeing how, you know, the veterinary technicians, or, you know, they're veterinary nurses now, they you know, were at the forefront of it all and doing the treatments with him. But the veterinarian, you know, ultimately she was able to, kind of explain everything on a level that was able to get to me, but also to get to my siblings and also get to my parents, and then, ultimately send our guy home after his many flare-ups. So it was really then that I was just like, yeah, okay, this is for me. Plus, I like kind of like the puzzle of the fact that animals can't talk to us. So we really have to dive deep into kind of like other senses and really see what they're showing us. And I love that puzzle aspect when it comes to veterinary medicine versus, someone telling me that their pain scale is like an 8 out of 10. So
One of the things you mentioned, Vasia, really resonated with me because that is probably one of my favorite things about veterinary medicine, is that you really do need to be able to possess complicated medical knowledge, but also be able to translate that to clients. And that's one of my favorite things to do is, and teach students how to do, is to really be able to translate what you're getting out of a pet, out of a patient, and then communicate that to a person. So people that grow up thinking, I don't want to deal with people, I want to grow up and deal with animals. So much of what we do is communication with people. I'm an introvert. I'm a painfully introverted, but one of the things that I can do very comfortably is that, where I'm the expert in the room, and I also have the ability to communicate with pet owners. So one of my favorite things about this job is that component.
Yeah, and I love that you said that, because that really is one of my favorite things about veterinary medicine and being a veterinarian is we quite literally are at the epicenter of everything in this world. We have our own patients, right? Canines, felines, bovine, equine, etc. Like we have those species, but we do have to take care of the people that come with them too. And I love that. I love that we have a piece in all ecosystems in this life, in all aspects of this life. We really are the people who keep the homeostatic function of all these worlds going. I love veterinary medicine. So yeah.
One of the things that you mentioned is that your experience with veterinary medicine was largely with general practitioner. That was mainly your view of veterinary medicine. So I'm always curious about students that decide to specialize, because there are so many specialization options in this career. I'm always curious about what it is that made you come into this thinking general medicine, but then within 3 years really figure out that you wanted to do so much more and consider a specialization path.
Prior to veterinary school, I worked as a licensed veterinary nurse, so my current title is certified veterinary technician, which nowadays it's translated to a certified veterinary nurse or a licensed veterinary nurse, depending on the region you're in. And so I actually got the chance to work at a specialization hospital where I got to see specialty medicine. I worked in the ICU department of a large level 1 trauma center out here in Boston. And it was there that I really got to see how different all these areas of medicine are, and how great of an impact you actually can make when you are kind of like the best of the best in one area. And so initially, I came in and I was like, I'm going to keep an open mind. I'm going to, maybe be the jack of all trades, master of none. Because I really loved the fact that I could be a part of, again, everything, whether it was small animal medicine, large animal medicine, public health, etc. So I came in with a really open mind. And it was during my time during didactics that when we were going over any bovine medicine or even equine medicine, that it was very difficult for me to kind of grasp it. And, regardless of how many hours I put in studying, regardless of how many veterinary podcasts I listened to, regardless of how many notes from friends who attended different universities I went through, like it was a very difficult topic for me to grasp. And so that was when I was like, okay, large animal is not going to be for me. I will have a horse and I will have, a little mini farm, but I'm not going to, practice medicine. And so that's when I really looked towards small animal medicine and really started to dive deeper into all the specialties that are involved there. And I really fell back on my time as an ICU technician to really figure out, what I loved about that area of medicine. And so at the hospital that I was working at, my criticalists were actually the ones doing emergency procedures. So they were the ones who were placing emergency tracheostomy tubes. They were the ones placing esophageal tubes. They were the ones doing, everything. And so I loved that aspect. I loved being exceptionally trained to be able to perform these tasks. That was kind of my driving force, because I loved, as a technician, I was able to do a lot of advanced technical skills, placing central lines, arterial lines, etc. And I said to myself, okay, like, what can I do as a veterinarian that would kind of set me apart from, aside from being able to diagnose, prescribe, etc. What else can I do? I love these really cool technical skills. And that's when I saw that the veterinarians at the hospital were like placing tracheostomy tubes. They were doing all these really critical stuff. And that's when I was like, yeah, okay, that's what I want to do.
So you mentioned, talked about the fact that you are headed into specialization. When and how did you finally decide what was going to be your area of specialization? And then what was it that actually sort of committed you to that path?
Great question. So it was actually, I want to say it was my junior surgery lab. So third year, when we had our junior surgery lab, I was the anesthesia student for one of our surgeries that we had. And I fell in love with just how the whole process about it works, how, my position, I had to do my physical assessment on the patient. I took care of them throughout the entire time. And then, recovery wise too, I was there through the whole process and kind of helped them through that entire process, and made it a really, pleasant experience for them, to the point that, when they woke up, they were still wagging their tail at me. But it was during then that I realized that I love the anesthesia aspect. I am not too keen on cutting into things. I am not too keen on the surgery aspect. I was very, very, very nervous about, doing my first neuter. And I just kind of realized right then and there that I was like, I'm very fortunate that I got a neuter for my junior surgery and not a spay, because I am like so afraid to go into the abdomen, or at that time I was. But it was kind of then at that point that I was like, okay, yeah, I don't want to be the one, doing whatever the surgical procedure is. I want to be the one on the outside monitoring my patients, looking at these trends, seeing what's happening, and kind of correlating it, again, putting that puzzle together. And so that's actually around the time when I reached out to Dr. Tebow. He's one of our anesthesiologists. I reached out to him and I told him that I'm interested in this, and I used to be a licensed tech, and I did anesthesia for a little bit when I was a technician. And what do I do? How do I go about this? And so he and I have been talking a lot through the whole process, and he's helped me kind of navigate, what I should do next. And I also realized that I love when things kind of go awry. I love chaos. Critical care aspect of things was it was when I first started clinical rotations in spring of 2024. My first rotation was emergency and critical care. And I kind of set myself up that way because I wanted to make sure that emergency and critical care was the route for me. And so I wanted to go in, kind of just jump right into it, immerse myself into it. And I had quite a few critical cases come through on that first round of rotations, which was great. Because it really did solidify the fact that I was like, okay, yeah, critical care and anesthesia, like these are my two loves. These are my two passions. I love being on both sides of these things. What can I do and how can I go about this now to do both? And I've been fortunate to have really great mentors, both on the emergency and critical care side, as well as the anesthesia side, to kind of help navigate me into my next steps, which is a rotating internship.
I think it's funny that we both have surgery to thank for deciding what we did want to do and what we didn't want to do. I had a very similar experience to you in junior surgery. My junior surgery animal was a 1.5-year-old intact female German Shepherd who was in heat. And so I was elbow deep in this spay, and it was horrible. And I knew then I didn't want to do surgery. But when I fell in love with internal medicine and lung disease was on my soft tissue surgery clerkship as a fourth-year student at Wisconsin. We had a dog that came in through emergency. It had an intestinal foreign body. We did exploratory surgery, removed the foreign body, and did a resection. So removed a section of the intestine that had become devitalized. So we had to remove that small section. The dog did fine immediately after surgery, but then developed postoperative pancreatitis and then developed aspiration pneumonia. And what I fell in love with that case was the pneumonia. It wasn't the surgery, it wasn't the pancreatitis, it was the pneumonia. And so I really fell in love with how the respiratory system functions and what kind of things, what kind of derangements cause it to go wonky, as you say, or go awry or go chaotic. And so I really researched this pneumonia, talked with the surgery resident on the case. He said, you go talk to a medicine resident about this. I just care about the surgery. But I fell in love with the lungs and fell in love with explaining to this owner how this respiratory complication occurred, and it was really just lung disease from then on. So it was very much a surgery case, but it was not the surgical part that I liked. It was the respiratory complication that made me fall in love with the lungs and lung disease. Dog named Bailey. It was a young golden retriever named Bailey. It was 27 years ago. I remember it like it was yesterday.
And how did Bailey do?
Bailey did great. Yes, a few extra days in the hospital, but Bailey did get dismissed.
So I have a rather funny question to ask, mainly to you, Dr. Carey, but Vasia, you probably have an experience like this too. Was there a specific moment or a case, either when you were a student or an intern or a resident, when you thought, I'm doing this, I'm the doctor now? And can you tell me a little bit about that?
My rotating internship, so it was my year here. So graduate from Wisconsin in May of 2000, and then July 1st, 2001 is my first day as a doctor. And one of the first cases that I had, another young golden retriever, but it was summer in Michigan, and the owners were playing fetch with this dog, and they were playing with a stick. They were throwing this branch, about a 2-foot long branch, throwing it, and then the dog would go chase it and grab it and pick it up. And they said that they threw it, and the stick landed in the ground. The end of it landed in the ground, and the dog ran straight into the stick, into its mouth. And they brought the dog in. It was just horrendous. Oral bleeding. There was blood everywhere. And I was the doctor on. And that was the moment that I said, there's nobody here for me to look at and say, what do I do with this?
Where's the doctor?
Yeah, so I was the doctor at that point. I remember that case very much. And just like you said, Vasia, it was the nurses that helped me, that kind of made suggestions. Maybe, Dr. Carey, you want to consider doing this? And I said, yes, why don't we order that? And so the nurses really did walk me through. But I was very much the moment that I knew that I was the doctor. And again, that dog did wonderfully, but it was really the guidance of the nurses who had seen that same emergency probably 20 times that guided this novice doctor through what I was very clearly over my head at that point, but I was the doctor that moment.
Yeah, so I'm not practicing at this time. Obviously, my internship doesn't start until June 9th. However, Michigan State has this amazing opportunity where you can essentially take what's called a special problems in small animal clinical sciences. And this is a clerkship where you can essentially select any rotation that you want to do, almost like advanced or more training in, or just like more exposure in, and kind of get more advanced cases in, with the knowledge that I wanted to specialize, as well as, go into an internship and kind of want to be more prepared into certain areas, emergency critical care and anesthesia. I jumped at the opportunity to go ahead and do this clerkship. And so I did one rotation in anesthesia and I did one rotation in emergency critical care. It was during one of my cases on anesthesia where I had a dog who I believe was a septic abdomen, and I had to create the protocol. And so we're the ones responsible for picking the drugs, why we're choosing them, etc. And when you're the special problems student, you kind of pick it all, and then you have to go to your anesthesiologist and explain why you're choosing these drugs, explain why you're choosing these doses, and kind of have more knowledge and more background on what all these drugs do. So that was kind of a moment where I was like, oh, okay, this is me now. Like, I'm actually the one doing this, and I'm the one picking the medications. And it was also a really good feeling whenever the anesthesiologist looked over your math, looked over your drugs, said, yep, this sounds good. And like, just handed you your paper and you were like, and was like, it's on you now. So that's a really fun one. And then I did another one in emergency and critical care. And that one I really loved because I was actually the point person in communicating with clients. And I had a lot of emergency internal medicine cases come in. We had a lot of, immune-mediated thrombocytopenias, immune-mediated hemolytic anemias. I had a lot of those cases come in, and they were really, really sick at the time when they first came in before we transferred them to internal medicine for further workup and further care. But I was the one who, in support of like the resident next to me, I was the one communicating with the owners, telling them, this is what's going on. This is what's happening. This is what we need to do. This is, estimate wise, this is what we're looking at. So I was having those really hard and difficult conversations that a lot of the times, vet school doesn't always prepare you for. And so that was a really beneficial rotation for me. And that was kind of another moment where I sat there and I was like, oh, this is on me now. Like I'm the one doing this. I'm the one communicating this. And the resident would jump in, if needed. Yeah, those were kind of my moments where it was starting to get a little real at that time. And I was like, oh boy, it's coming up fast.
I think it highlights something about veterinary school that a lot of people don't really know, is that you spend most of your time being trained by specialists who all love what they do and who all want everybody to love what they do. So you might come into veterinary school thinking, oh, I'm going to get this general practice education, and then I'm going to get through my 4 years, and then I'm going to get shot out the door and go into my general practice setting. But you have to navigate this minefield of your 4th year where you're spending 2 or 3 weeks at a time with people who intensely love what they do and intensely want you to love what they do as much as we do. And I feel that a lot of students who think they're going to go into general practice get swayed during 4th year because you're just surrounded by people who are so enthusiastic about their specialty area, and they tell you how wonderful you are and how great you would be in our specialty area. So I think a lot of people don't know that people come into 4th year thinking they're going to general practice, and a lot of them don't make it through in GP because we convinced them that they would be fabulous in an advanced training program. So I wonder if maybe you talk a little bit about your 4th year experience and how that swayed you. That was very much for me how I ended up going into an internship and how I ended up going into internal medicine was I had a specialist. Her name is Lauren Trepanier. She's just about to retire from the University of Wisconsin. But on my internal medicine clerkship, we were sitting there looking at radiographs at about 8 o'clock at night. And she said, you would be fabulous at this. And that was the start of my investigation into what internal medicine is. What does the life of a specialist look like? And from there, it just kind of took off.
So my 4th year of vet school. So my 4th year of vet school was a whirlwind. Like you mentioned, a lot of people kind of go in with the thought that they'll go through their clerkships and then they'll graduate and go into general practice. And, my class, actually, a lot of us ended up either applying through the match program, or they did it outside the match where they're actually going off into specialization training, rotating internships or specialty internships. There's like a good chunk of us who are deciding to go into specialty training and do a rotating internship, which is great. I would definitely say the moment for me as far as my clinicals where, choosing emergency and critical care medicine was kind of the one for me. It was my first round. So my first rotation through emergency and critical care. And I had a dog. She was like a 7-year-old shepherd mix, and she came in for acute onset of collapse. And she ended up being what we call a bicavitary effusion, or she had fluid in her abdomen. She also had fluid in her chest. Or her chest cavity. And it was kind of in that moment, I was working with Dr. Rebecca Yule. She's now our 3rd year ECC resident. She and I were working together. We were talking about the case, talking about lists of differentials, etc. I got to then perform an abdominocentesis, and I got to perform a thoracocentesis. And when we reflashed, took the ultrasound probe and checked the patient's chest again, we actually saw that she was a tricavitary effusion. So she also had fluid in the pericardial sac around her heart. And then I got to then do a pericardiocentesis with Dr. Ewell by my side too, which was great. But because of that, it kind of changed our differentials a little bit more, and kind of changed the conversation that we were going to have with this owner. And it was in that moment that Dr. Yule and I are going to chat with the owner. And she just kind of looked at me and she was like, I want you to know you've really crushed this case. And I was like, what? Me? Like little old me? What do you mean? Kind of like deflecting and being like, no, there's no way. Like I'm just starting clinics. And she just gave me so many words of encouragement. And she was like, you would be great. Like you did incredible on this case. You nailed all the questions I asked you. Like she was like, I'm actually thoroughly impressed. And it was that moment that I was like, okay, yep, this is it. This is for me.
It's infectious, isn't it? I mean, you get that kind of praise from someone who you see as someone you'd like to emulate, and just getting even those little bit of words of encouragement, it really goes a long way in making you think, yeah, I can actually do this, or maybe I can see myself in that kind of a career.
Yeah, it was definitely, it was intoxicating.
To that end, Dr. Carey, knowing full well how intoxicating it can be and how compelling you can be when you're working with students, how do you help students see the full spectrum of the veterinary profession?
I think it's important for faculty to do both. I think I have to be really enthusiastic about my profession, but I also try, and I'll give a little bit of background. My wife runs a business where she works with people with invisible disabilities. And there are a lot of veterinary students. I don't think people realize what percentage of professional students, graduate students, including veterinary and medical students, either have declared invisible disabilities like learning disabilities, like dyslexia, or undiagnosed disabilities. And one of the things that I learned from her is how to engage with neurodiverse populations. And so I really think it's important for us to make connections with our students. And I think different people are going to reach those connections in different ways. And so one of the things that I try to strive to do in preclinical and on the clinic floor is make sure that everyone has the foundational knowledge they need to get out of veterinary school. As much as I want everyone to be an internist and specialize in respiratory disease, I think it's incumbent upon us to recognize what people really need, and that might not be my area of specialization. So I think it's important that we really engage with people for what their needs are going to be, understand that I'm not going to get everyone to be a small animal internist, but really make sure that you, as a faculty member, make connections with students so that they have their needs met during fourth year. And then a big part of my job as a faculty member is to train residents, and residents in the academic setting also have the responsibility to be teachers as well. So training residents on how to teach students, how to recognize when a learning opportunity is available, and to really make sure that you capitalize on it. So I love the teaching part of my job, but I love the training teachers part of my job even more, and it just kind of builds on itself.
So I know you've taught so many students. You and I have worked together for 14 years, and I've seen the students come through, and you're always a consistent favorite. And I should mention, since our commencement ceremony is in a few days, that Dr. Carey was chosen by the class to be one of the hooders at our ceremony, and it's not for the first time.
It is a fabulous honor. I really appreciate your class doing that. Thank you, Vasia. So
in your years teaching, what has changed about how you teach?
Many things have changed about how we teach, the way that we teach. I went to school where it was 50-minute lectures from 8 o'clock in the morning until 5 o'clock in the afternoon, and you sat in your seat and you just took notes on the lectures. I do think that we've now recognized that works for some, but it doesn't work for all. So I do think that we talked a little bit about neurodiversity and about having a more universal design of education. So I think we've created different ways to connect with learners. We're not just delivering content in the same way. But I have 28 and 25-year-old daughters, and they teach me how important it is to understand that people can get information different ways. Like if someone doesn't understand something, they have very rapid access to technology that's going to give them the answer. And so my role in teaching is changing because the access to information and technology is so great. So you have to be captivating. You have to make connections with people, and you have to really help them understand why their foundational knowledge is important, because you're going to be building on that. So I like to try to talk about the big picture and then have people see the part of it that they're learning as a part of that bigger picture. And one of the ways that we do that is we bring first and second year students into the clinic. So we can teach them basic physiology or basic pathology, but give them an opportunity to see what you're learning now in first year, here's how it's going to apply to what you're going to be expected to do as a veterinarian. So I think it's really important that you not just focus on pounding information into them, but really give them the relevance to understand, yes, this is going to be important, and here's what you're going to be doing with this in 2 or 3 or 4 years.
My final question is, if you could go back and talk to your pre-vet school self, tell them one thing about where this journey would take them, not just the job, but the life, what would you say?
I would give myself the advice that I give currently to students, which is to be open to all possibilities. You're going to come into school thinking you know where you're going to go. We're all high achievers. We all think we know ourselves really well, and we're going to come into vet school and we're going to declare, I am going to do this. I'm going to go through my 4 years and I'm going to come out the other side doing this. But my residency advisor, Dr. William Schall, told me that most careers involve 2 or 3 major pivots, and that you need to be prepared for an opportunity that comes at you at the absolute worst time. So being open to all possibilities that fall in front of your lap is the advice that I give to students now. And it was advice that I got from my advisor. So I would go back to myself back in 1996 and say, be ready for a wild ride, because I thought I was heading here. I promised my wife we were going to move to Michigan for 1 year. We kept our house and our bank accounts back in Madison, Wisconsin, because we were going to move back. And 25 years later, I'm still here. And it's because of the opportunities that fell in front of me that I thought, this is the worst possible time for this to happen, but I can't turn this down.
That is a great answer, Steve.
Yeah. I don't know how I can top that, Dr. Carey. I think my advice, like my biggest thing is like, don't give up. Like when there's a will, there's a way. And, it doesn't have to be a straight shot, right? You don't have to do the 4 years and then 4 years of undergrad, 4 years of vet school, and then 7 years or even 3 or 4 years right out of vet school. Like it doesn't need to be back to back to back. Like you can take time for yourself. You can, the greatest thing about, I feel like with at least education and specialization training, vet school is always going to be there. Specialization training, whether it's residencies or internships, those are always going to be there. And so in the moment that, maybe life does get in the way or certain things happen, it's okay to, say like, let's pause. I'm happy where I am right now. I'm in a good spot. I could probably hold off on this for a little bit, get certain things, arranged where I can then continue on in my path, but just never give up on, what your end goal is and what your dream is. That would be my advice.
Good advice. That wraps up our conversation with Drs. Steve Carey and Vasia Murphy. We hope you enjoyed hearing about their experiences in the field of veterinary medicine and education. If you like this episode, be sure to follow us and share with your friends. And as always, stay connected with the MSU College of Veterinary Medicine for more inspiring stories and insights shaping the future of veterinary care. Thanks for listening, and we'll see you next time.